The familiar question, am I my brother's keeper, appears in many contexts. So people who have chosen careers in healthcare have already answered it affirmatively. Arguments arise as to how that has to be done. No one can be accountable for everything and everyone, but neither can we hide behind the excuse that it's not my job when there's so much important work that needs to be done. A good way to start sorting things out begins with knowing what each of us is qualified to do and what we can contribute. Obvious examples are obligations to one's own family, our responsibilities as parents and spouses and siblings, these tasks that can't be delegated to others. But with the extended family or close friends and colleagues, there are also similar concerns. They trust us to know them well and to be aware of signs of change or trouble long before any outsiders would notice. And for many counselors, even larger family than that of just the workplace is the world of AA. That remarkable organization asks little of its members in return for what it gives, and it requires only that its customs and traditions be followed if its name is to be used. These guidelines keep AA intact as an organization so that it can remain available and effective for those generations to come. And counselors need to consider the short term needs of their patients within the context of AA's overall well being. AA policies, they've been set only after really considerable deliberation. And there's been a great deal of grassroots input through regional delegates, as well as through the processes of group conscious. So, protecting AA or other 12-step groups, understanding them well, and presenting them fairly are going to be important for both the counselor and the patient. And it's really beyond the scope of this discussion to do more than just mention a few areas where problems might arise. Um, some common problems include misunderstandings about anonymity. Unauthorized professionals might present themselves at media level as AA spokespersons, and this implies that AA has endorsed or became affiliated with that particular treatment effort or that philosophy or actions that AA has always been really extremely careful to avoid. Um, Tapes have been made of AA talks given at both outside meetings and in treatment facilities, which are then played for other groups without the speaker's knowledge or permission. A particularly striking case involved the use of a surgeon's AA personal story that was taped without her knowledge or permission and then played for her medical students. An unthinking but well meaning person thought that, the students would be particularly interested in the experiences of a fellow physician, and indeed they were. Well, and although there is a lot of overlap, the AA tradition of anonymity is not the same as the professional ethic of confidentiality. Both are concerned that the rights of the chemically dependent person, is taken care of, as well as the integrity of the entire chemical dependency field. All that has to be protected. The AA tradition of anonymity needs to be understood by both AA members and others who have any dealings with AA. And that tradition of anonymity is not intended to perpetuate the stigma of alcoholism, but it's there to prevent ego trips among its members and to reassure newcomers who might fear for their reputations, and also to protect the fellowship both from adverse publicity, if a member relapses, and from individuals appointing themselves as spokespersons. There's an AA pamphlet, Understanding Anonymity, and it's based largely on the writings of, co-founder Bill W. And it delineates a nice balance between grandiosity and the excessive secrecy, which could prevent alcoholics from receiving the AA message. Traditions 11 and 12 forbid self identification as an AA member through the media, while allowing one to identify oneself freely as an alcoholic. And they forbid any unauthorized disclosure of another member's identity, but they do allow one to identify oneself as an AA member, below the level of public media. So customs differ within the fellowship. Some groups use only first names, yet full names are used within the majority of AA groups. There's like some 80% of those attending one AA international convention. Um, a particularly tricky issue involves the attempt to get an AA group to undertake a reporting or monitoring function. Often, we have courts or employers, they're willing to have an alcoholic attend AA meetings as a substitute for punishment or residential treatment, but evidence that attendance actually occurs is going to be required. And that poses no problem when the meetings are open and, noses are not counted by the AA group itself. The difficulty arises is if AA is presented to the newcomer as an extension of a coercive system that not only spies on members but then reports back to other people. Some problem drinkers who have been forced into AA closed meetings have no stake in refraining from gossip about the people that they see there or what they hear. They also feel very little or no responsibility for the smooth running of the meeting, nor do they feel a need to contribute anything more than their required physical presence. Granted, there are some reluctant people that do get exposed to AA in this fashion, and many of them just go on to become sober and active and enthusiastic AA members. Others are taught that AA is just one more organization that may talk about anonymity and freedom of choice, but they're willing to join the establishment in coercing them. While some lives are undoubtedly saved by these tactics, other people are left with an experience that's going to prevent them from seeking AA's help in the future. And there's other ways to establish attendance without having AA groups fill out sign-in sheets or assume the role of the police. Alcoholics don't need new lessons in cynicism from the organization most deserving of their trust and confidence. And it's easy to ask AA groups to fall into these traps, particularly if they're, blackmailed with the threat of that, refusal may cost a fellow alcoholic their liberty. The long range effects need to be considered and better methods need to be devised. AA guidelines, cooperating with the court, ASAP, and similar programs, they offer practical suggestions based on how these problems have been handled in some AA groups. And these guidelines note that it's not the business of AA members to question what pressures from court, physician, spouse, or their boss may have brought the newcomer to the AA meeting, as they would have resented being so questioned when they came in, but to make the AA program attractive to those who do come. Thoughtless referral practices have also caused trouble. One treatment center sent a whole busload of chemically dependent patients to a small town AA meeting, and that overwhelmed the group's total membership of 18. And the treatment unit involved refused to stop the practice, so the AA group went underground and they concealed both the time and the site of this meeting. In another city, a group of actively drinking young men who had been court committed to a heroin treatment program were forced to attend AA. They were disruptive, somewhat frightening to the members, and ultimately contributed to a backlash against drug users that's really caused friction with AA in many parts of the country. And when AA and other 12-step groups are treated with sophistication and their mores are understood and respected, counselors and groups can usually work out procedures that satisfy the needs of both parties. It's not fair for counselors to be so inconsistent on, or I'm sorry, not inconsistent, but insistent on the particular needs of their own patients that they expect all the rules to be broken on their behalf. The resulting upset and chaos can take many months to make it right. And finally, we have obligations to the community at large. Um, Those of us with special knowledge and expertise need to share it if others are to write and pass the laws that affect our present and our future patients, as well as the countless others whom we will never personally know. AA as an organization quite wisely refrains from politics. They neither endorse nor oppose any causes, and they stay out of controversy. And this has proved a wise policy, and it should continue. Individual AA members, on the other hand, they may merely be uninterested or for other reasons may choose to hide behind the tradition of anonymity as an excuse for inaction. Others have sometimes confused what AA considers good policy for the organization, anonymity, with what they should do as individuals, um, advocacy. Neither AA membership nor recovery from chemical dependency or any other illness should curtail the rights, the privileges, or the obligations of citizenship. Recovery is not just abstinence, even though abstinence must always come first. So, participation in the world around us is a part of recovery. To register and vote, to write to our legislators, and to appear at public hearings are things that we should do if we're to make our democracy work. And for many of us, this has meant learning about politics rather late in life, but we must learn. As members of NCADD with its network of local affiliates or of Employee Assistance Professionals Association or the National Association of Social Workers, the American Psychological Association, the National Association of Alcoholism and Drug Abuse Counselors, the American Society of Addiction Medicine, the National Association of Addiction Treatment Providers, and other professional and advocacy groups. Many AA members do what they cannot do as members of AA and do so without violating the anonymity. Bill W., Marty Mann, and Senator Harold E. Hughes, they all testified before Congress just simply as alcoholics in recovery. Whether they were AA members wasn't mentioned, nor at the time was it pertinent. If we don't take a hand in the political process, if people who are concerned with the well-being of those who are chemically dependent remain silent, others are going to continue to make important decisions for us. And in the past, they've not always made these decisions wisely. And there may be decisions to be made. Are we to have warning, content, and ingredient labels on liquor bottles? What blood alcohol level makes a driver intoxicated? Should people under age 21 be allowed to buy liquor? And should it be sold in drugstores and supermarkets? When federal money is divided between the needs of the chemically dependent and the mentally ill, how will the shares be allocated and how large will they be? Do we want insurance coverage for chemical dependency treatment? To who, for what, and where shall it be given? Our entire healthcare system will be undergoing major structural change now and in the years ahead. And probably not in one vast upheaval, but in a series of smaller changes, both nationally and state by state. Our professional organizations need to stay abreast of these changes, and when they ask us to back them with our own actions, we should. Politicians are not interested in our personal histories, nor do they care whether or not we've recovered from chemical dependency. Like a lot of people, their primary interest is in themselves. They want to know if we're going to vote for them, contribute to their campaigns, and get others to do the same. And if they believe that we will, they will pay attention to us. A surprisingly small effort can make a big difference in their actions. As long as we make an effort to be involved politically, we can't be blamed for failing to make a difference. We will sometimes be ignored, but we can't be blamed for not even trying. A code of ethics is not complete without considering our obligations to respect other professionals and agencies. We may disagree with their philosophy or their treatment methods, but unless they're downright harmful or malicious, professional courtesy requires us to not make unseemly comparisons. The chemical dependency field has been plagued with turf battles and jealous rivalry, and this confuses the patients, and it harms both the individual who stoops to this and our fledgling profession, which is struggling to gain public respect and find a place among the older professions. We look small, when Treatment Center A gloats over its success with Treatment Center B's failures, while over at Treatment Center B, the converse is happening. One chairman of the AA General Service Board has stated, progress in this field will be made in direct proportion to the degree of respect and cooperation between AA and the treatment facilities. And this is fully cognizant with the history of AA as seen in the book of Alcoholics Anonymous comes of age, and with AA's stated intent not to oppose or endorse any causes. False and misleading advertise is both illegal and unethical. Advertising by treatment agencies, properly done, can really benefit the public by removing the stigma of the disease, emphasizing that it is treatable, breaking down denial, and letting victims know help is available. But abuses can creep in. The advertising code of the National Association of Addiction Treatment Providers says that advertising should emphasize the desirability of treatment without referring to any specific or absolute percentages of recovery. And it should not imply that recovery is patently simple or comfortable or effortless. The National Association of Addiction Treatment Provider Code forbids self promotion through negative implications about competitors. Clearly unethical is the policy of one group that promotes itself largely by derogatory and often false statements about AA, for example, that it's a religion. AA meets none of the major elements of the accepted definition, and it welcomes atheists and agnostics, and that it fosters overdependence. But on the contrary, AA is a program of self growth among peers. It's healthier than dependence on therapists. Furthermore, the quote unquote powerlessness that this group criticizes actually gives alcoholics the freedom to choose not to drink instead of slavery to the bottle. And the real conflict arises when we become aware that a person or an institution gives poor care or exploits or endangers their patients. Do we sound the alarm or look the other way? Can a way be found to promote change? A profession is supposed to be self regulating, acting from professional integrity rather than fear of prosecution or lawsuits. Most professional organizations have ethics committees and conduct review boards, and the members are expected to inform them of any unethical conduct. This is not just mere tattling or gossip, but the way in which a profession gains respect and trust. Intervention with a colleague is aimed at being helpful, not vindictive. The danger of an incompetent worker harming clients must be averted. If concern for peers is a hallmark of the professional, we need to be aware of one another and be ready to reach out in times of trouble. And this can be an obvious action, like helping someone through a bout of serious physical illnesses or divorce or family crisis. It can be more difficult if a colleague relapses into drinking, experiences emotional illness, or acts unethically, putting patients at risk. No one wants to be seen as intrusive or prudish or judgmental, and nobody enjoys confronting a friend. And just as members of nuclear families may compound their problems by enabling or covering up for each other, so too can treatment staff. And so, for similar reasons, recommendations for employment must be honest and not reflect the good old boy syndrome. Qualifications should be carefully checked. In one instance, an applicant gave the impression that he had completed a certain training program when he had actually received a D in the basic course and dropped out. Clean drug counselors have been found to be active alcoholics. The ethics of publication are too often violated in the addiction field, where the copy machine too often engenders a failure to respect the rights of authors and publishers to their just earnings. This is stealing and it's a violation of US copyright laws. Plagiarism involves the borrowing of another's material, copyrighted or not, without proper permission or printed acknowledgement of the source. An increasing problem is that's created by the easy availability of audio tapes or CDs or MP3s. Speakers are often not asked if they object to being recorded. Their remarks have later been known to appear verbatim over somebody else's byline. Others who've agreed to share their personal stories with a particular audience find that recordings were made and sold or shared without their permission. And some of the worst offenders have been AA and other 12-step group members who might not gossip or reveal the full name of a fellow home group member, but assume that anyone who agrees to be a speaker at a larger gathering has renounced that right to anonymity. Most of these problems can be avoided if expectations are made clear in advance. If speakers at a conference are going to be taped, they have the right to know that before they agree to the engagement. If a paper will be expected or remarks printed as part of the event's proceedings, that too should be understood. If the speaker is to be paid, financial arrangements should be clear and these obligations met promptly. And one of the reasons a doctor wears a hood along with his or her graduation gown is the doctor's hood is used to provide a place where fees could be discreetly tucked at the end of a visit to a patient. Neither party then had to face the indelicate problem of discussing money. And some people may still, you know, be uncomfortable discussing monetary compensation. But we owe it to our fellow professionals, a fair fee for their time and their talent. And if we can't manage this, they need to be told. They may choose to donate their time, but they deserve to know if that's what's being asked. Even, if the professional fee is waived, courtesy and consideration demand, travel and other expenses be reimbursed. Conversely, we have employees that have ethical obligations to the institution that employs them. And employees may sometimes need to challenge the policies to serve the patient's best interests. And if this is not the case, one should be loyal or look for another position. Respect for institutional policies and management functions is essential for the serenity of all who work there. It's going to be important to learn how to work through channels of authority in order to affect change instead of undermining or misrepresenting an immediate superior. In general, it's more constructive to work through the chain of command, to complain to the director, not the members of the board, unless it's a question of the board removing the director. Professionals must always be conscious of the differences between speaking as individuals and speaking as representatives of a professional group or an agency. And speakers must realize that their position and obligation to others may at times severely limit their freedom of speech. Lying isn't necessary, but there are times to step aside and let someone else be the speaker. And then we come to the ethics of using animals for scientific experimentation. You know, it's received thorough treatment from the AMA and the APA, but both insist on taking all reasonable precautions to ensure that animals are not abused or made to suffer. Certainly they should not be used when non living substitutes are available or when the knowledge gained is going to be trivial. Some arguments based on the rights of animals as living beings would logically make the entire food chain immoral. The search for a cure of a major illness is not the same as creating a new cosmetic. Our obligation of humane behavior towards animals stems from our status as moral individuals and stewards of lower creatures. Um, abuse of animals is a violation of our own human nature, not just of animal rights.